Yes, and I first want to thank his ministry and the CEO of SHA, because they made an intervention for a patient. I think that was last week, who was being asked to pay an advance payment of 45,000 shillings in a private hospital in Kisii before accessing dialysis. And I think that was an attempt by the hospital to extort money from a patient who is fully covered by SHA. Now, Mr. Speaker, sir, the CS has emphasized that it is important for Kenyans to go through cancer screening. And I just wanted to get the thoughts of the minister, how he can assist the, the very vulnerable Kenyans who are supposed to get these services from our county referral hospitals, yet those hospitals don't have the facilities to do cancer screening. I can give an example of my own county of Nyamira. We don't have MRI machines. We don't have facilities that can allow patients to go through intestinal cancer screening. I think what they call endoscopy. If you go to a private hospital like Nairobi, I think they charge about 37,500 just for the facilities alone. The doctor will charge another 55,000 shillings. Yet at the counties, Mr. Speaker, I don't know about your county of Meru, but most of our counties don't have these facilities. In fact, in Nyamira, we don't have an oncologist. We don't have an MRI. We don't have a radiologist. So even if we urge Kenyans to go for screening, the only fallback is to go to our private hospitals. In that region, there is only one private hospital, Oasis, that can allow patients to go through screening. So my question is, can SHA, the SHA card, especially Kenyans who pay 500 shillings, can they enjoy this service of early cancer screening in our private hospitals using the SHA cover? Because the facilities are not in our public hospitals. And Waziri, I'm willing to visit with you my county hospital of Nyamira, or you can make reference to the auditor's report, financial year 2024-25. He has highlighted that all these specialists have not been employed by our county government of Nyamira, plus all the 3 other level 4 hospitals. That is the situation. So I want to know whether that service can be available to the people I represent to get the cancer screening. Thank you, Mr. Speaker.
Okay, last but not the least, Senator Miraj Abdullahi.
Asante Mheshimiwa Spika. Swali langu kwa waziri ilikuwa ni kumuuliza kuhusiana na masuala ya malipo ya SHA katika hospitali zetu kuu za referral, hususan ile yetu ya Pwani. Lakini katika changizo zake nimemsikia amesema ya kwamba tayari wametayarisha malipo hayo. Kwa hivyo yangu ni pongezi kumwambia ya kwamba sisi kama Wapwani tunaitegemea sana hospitali ile, na tumefurahia pia kusikia ya kwamba kuna facility ya kansa inaendelea kujengwa pale ndani. Asante Bwana Spika.
Kanuni ninazotumia hapa haziruhusu wewe utoe shukrani saa kama hizi, ni maswali tu ya ziada. Lakini ni vyema, wengi wameshukuru waziri, na sina bundi na mimi pia kusema anafanya kazi jema. So there are 3 just supplementary questions from Senator Kongo Mweni and Senator Kibwana and Senator Njonyu. If you do that in 1-2 minutes, we'll be concluding with you, Waziri. Thank you.
Honorable Speaker, I will be very fast. Honorable Senator for Machakos, Senator Mudama, I really understand your case. SHA has paid 400,000. That is all they could pay as per the benefits of the patient. Now the patient has 800,000. From my experience, even now as a leader and when I was in Parliament, there are some bit you have to pay yourself. We have to do a rambe for that 800. Me, you, and many others. So, no, you have said only the family has raised 100. So what you do, send me the list. Please see how much we can raise, and then I will see how much the hospital can waive. And I will deal with that matter. It's very urgent. We don't want to keep bodies. It's against, it's immoral, it's unconstitutional, and I will do, but we should also protect our hospital. But that one, I'll deal with it. And there's a certain threshold that we can ask KU to RH to waive. To my good friend Senator Nyutu, I want you to go to Kenyatta Hospital today. Just yesterday alone, Kenyatta Hospital was paid 531 million by SHA. It was number one. For many reasons. One, it has a high number of patients, and two, there is a new good leadership. We have removed all the corrupt ones. And the board led by Abbas Gulet, former Kenya Red Cross chair, and the Siampe who was before in Kenyatta, and now they are doing extremely work. 11 wards are being refurbished. Even their money, the little that goes through e-citizen platform, they get it. So what you read in social media is fabrication. In fact, I'll be going to launch another section of Kenyatta. I'll look for you. So Kenyatta is not the Kenyatta of the yesterday. And I really want to tell the country, both the private wing, and in fact the private premier wing of Kenyatta now is being used by our leaders. So Kenyatta is doing well. It has enough money, and e-citizen has transformed our country. Senator, e-citizen has transformed our country. You might not like the president who introduced it or the government introduced it, but while you are sitting here, you can use e-citizen platform to sort out many personal community issues and payment. And you do payment here, Kenya Power, whatever, anything, KRA. So I think it has challenges. The way even, I'm not saying SHA is 100%, we have some operational challenges. The way M-Pesa sometimes is in a kwama, but I can tell you Kenyatta, and I'm ready to take you there. The supplies are there. They buy from KEMSA. Where they don't find KEMSA, they buy from the private sector. In fact, by next week, we are putting the 4th linear machine for our cancer patients. They serve 150. We want them to serve 300, 400. Kenyatta University is a premier. It serves Murang'a, Kiambu, Machakos, the whole of that region. But Kenyatta Hospital is doing very well. I think there was a question from Senator Omogeni. Senator, I want you to listen to me. I didn't want to say this, but I have to say, healthcare in Nyamira has collapsed. And it has collapsed because of your governor. I want to be very honest with you. There are about 3 counties where healthcare is collapsed. Let me give you a very good example. All the things you have said, all the equipment you have said, are provided for under the National Equipment Support Program. I was in Bungoma, his counterpart. There is a radiology, there is a mammograph, there is dialysis machine, there is even a CT scan we have launched, all under this program. And he is not putting a coin. The national government is not putting a coin. It is fee for service. Every patient who uses it is paid for by SHA. Your governor and Nyamira, he has signed for the next program, but he's unable to make a request. He's unable to make a request, and I cannot force him. So if he make a request today, by next week, me and you will go and launch CT scan. We'll go and launch all these equipments. But I can tell, and it's good, I think I need to be very honest to Kenya and to the residents of Nyamira, that I think it is morally wrong, it is religiously wrong for you to be a leader and to be a governor of Nyamira, and you allow the most critical sector to collapse because of leadership. I didn't want to say this, but I have to say it. Even the primary health care, which is free, level 2, level 3, the dispensaries and the health centers. It is free, government is paying for, and if you look at the money, if he does well in health and put the equipment, even the revenue of Nyamira County from the health sector will be the highest. I will give you a good example. Senator Miraj asked me, Coast General Hospital,